We have a lot of patients that come into the office concerned about the changes that they've noticed in their bodies following having kids. They love their children, but they don't necessarily love the changes that have occurred following having those children. The media has come up with a term, mommy makeover, that is used to describe the techniques that we have to alter some of those changes that have occurred. The procedures that are done differ from patient to patient because the changes that occur following pregnancy are different for everybody. One of the things that we feel is most important is when the patient comes in, we want to hear from her what is it that she sees that she would like to improve upon. Typically, we're talking about body contouring operations or procedures. So for some patients, it might be a simple procedure such as liposuction. For other patients, it might be a more involved procedure such as a full tummy tuck or abdominoplasty. And occasionally, we even combine that with breast surgery at the same time. Sometimes patients will come in and they'll complain about excess skin in their abdomen. Sometimes they'll complain about the roundness of their belly following pregnancy. An abdominoplasty or a tummy tuck is designed to address those situations. Typically, what we will do with the abdominoplasty operation will be to start with a little bit of liposuction in the flanks. We will then not only get rid of the excess skin on the abdomen, but we'll also tighten up the abdominal wall to get rid of the roundness that people can notice after pregnancy. What that will do then is flatten the abdomen and also restore the shape of the patient's waist to a more feminine appearance that she had prior to pregnancy. Some of the typical things that patients complain about after nursing children is either a deflated appearance to their breasts or a hanging down appearance to their breasts. If the breasts are deflated, that can be restored with a breast augmentation. A breast augmentation is typically done using an implant. However, sometimes patients have enough breast volume on their own, it's just that it's not in the right place anymore. And that's what a breast lift will take care of. We'll take the patient's breast tissue that they have and rearrange it to give a more conical shape to the breast, more projection to the breast, and to restore a normal appearance similar to that which the patient had prior to nursing her children. When somebody comes into Salmon Creek Plastic Surgery looking for body contouring procedures after pregnancy, we will at first bring them in for a consultation, which is at no charge to the patient. We want to hear from the patient what is it that they notice, what is it that they would like to improve upon or restore to a pre-pregnancy condition. Once we hear from the patient, then we will often talk about the procedures themselves, giving the patient detail about what surgery would involve and what some of the non-surgical options might be as well. We also go over the pricing for all these procedures and then allow the patient to come to her own decision about what would be best for her. Obviously, some things have downtime and longer recovery times than others, and that does impact people with the busy lifestyles that everyone has these days. The recovery from an abdominoplasty or a tummy tuck involves some time at home at first. Patients will have a drain in place typically, and they really won't feel like doing a whole lot for the first several days. The drain that's in place is generally removed at about 4 or 5 days, and the patient will at that point find that it's much easier to walk around, much easier to take care of herself. Following a tummy tuck, patients will often need help into the bathroom, but not in the bathroom, for the first 48 hours. They will feel better sleeping in a chair, often, like a lazy boy recliner, for the first week or two. Patients will shower at 48 hours, but they have to be careful how they do that. They will often stand with their back to the shower. After 4 or 5 days, the patient's drain is removed, and a pain pump that is often in place is removed as well. Patients will be driving at 2 weeks, but typically not before that, because it's hard to stomp on the brake when you've just had a belly operation like a tummy tuck. Most patients will feel relatively normal between 3 and 4 weeks, but will resume higher impact exercise like jogging or aerobics at about 6 weeks. Most people do feel like themselves at 6 weeks, and in fact, patients that have had a hysterectomy will often say that it feels like the recovery after a hysterectomy. Patients that have had a C-section will say that it feels like the recovery after a C-section, except that there's no baby screaming at you.